Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Michael Herman from the Chicago House. Michael is the CEO of the Chicago House. He is a born and bred Chicagoan, former Catholic priest, and a proud member of the LGBTQ plus community. Thank you for taking the time to join us today, Michael.
Hi, Michael.
Hi.
Well, it's great to be here.
Thank you. And could you please tell our listeners what is Chicago House?
Yes, I would love to. Chicago House is a nonprofit, a social service organization, and we provide housing services and wraparound support services to those who are living with HIV or vulnerable to HIV. We provide kind of an array of housing, health, employment services, and we also have a particular expertise in providing services to the trans community as well.
Okay, great. Thank you very much for that explanation because I had never heard of Chicago House before, and I'm sure that many of our listeners haven't. It's great to know that there is such a wonderful resource available.
And right here in Chicago.
Yes.
So, Michael, can you tell us about the history of Chicago House, how you began and how you got to where you're at?
Yeah, actually, we were founded. We're about 40 years old. We were founded back in 1985. And it really came around as a community response to the AIDS crisis in the mid 80s. Actually, people gathered around at one of the local drag clubs, the Baton Club in downtown Chicago, and community leaders who were concerned that their friends, their partners, those who they called family, were contracting HIV and shortly after contracting AIDS. And because of that, they were losing jobs. They were getting kicked out of apartment buildings.
wow.
Families would not receive them back. It was really a terrible crisis, and the community was trying to find a response. There were a number of organizations that grew up during that period. One was the AIDS Foundation of Chicago, who really took on the advocacy arm.
Okay.
It was Open Hands, who took on the food services, food delivery to people living with AIDS. And then Chicago House came about to provide housing for those living with HIV. And it really, in our early years, we were a hospice provider. So most people who contracted HIV quickly deteriorated to AIDS. And there was no cure, there were no medications at that time. And so people came to kind of live with a sense of dignity and to die with us. And it was very much a volunteer organization at the beginning, supported by people who would come and accompany people in that kind of final stages of their life and their illness. And then we've kind of responded to HIV as it has changed and adapted. So from a hospice organization, we really moved to permanent supportive housing for people who were living with HIV. After a while, we realized people were going to live long lives with HIV through the medications that were brought online. And so we started doing employment services, helping people to get back to work and to be able to be more independent. We've continued to adapt to the demographics of HIV in particular. HIV continues to have a great impact on our trans populations, particularly trans women of color. And so we created a program called TLC, our Trans Life Care program, which really wraps around services around those impacted with HIV. And now we are part of the concerted effort here in Illinois and across the country, which is called the Getting to Zero plan, to really bring an end to the HIV epidemic in the US. So very much a part of our history. We've grown and adapted over the years, but really we were very much a community-based grassroots organization in response to really a horrible crisis, which was the AIDS crisis.
Michael, I have a follow-up question about housing, just because one of the things I actually do in my job is looking for housing. for young adults with disabilities. Is it difficult to secure housing for your folks?
It is challenging. There's obviously more people who need housing than the units of housing that we have. So Chicago House participates in more collaborative efforts. We're part of what's called the HIV Housing Advisory Council. Uh, and the goal of that council is to really identify sources and to create as much housing possible for those living with HIV, particularly those who are impacted by homelessness.
Mhm.
And so that is something we do. There are a couple funding sources which are very helpful to organizations like Chicago House. And one of those is called HOPWA. HOPWA, it's a HUD program, and it stands for Housing Opportunities for People with AIDS. So that was a source of funding that came up early on to really help this crisis, and it's really been a vital part of our being able to house people
Okay.
living with HIV. But it remains a challenge. I know
Mhm.
the AIDS Foundation has about 1,000-person waiting list,
Yeah.
Wow.
people
Yeah.
living with HIV who are in need of housing. So there's still a huge need in the community.
And so I have a question as well. Is that due to the financial strain that the required medications are placing on the individual so that they're limited into how much of their income can be put towards housing? Is that the main reason why it's such a, I mean, it sounds like it's a serious problem.
It could be part of it, but one of the issues is that oftentimes people contract HIV who are already either low income or
Mm-hmm.
very low income,
Okay, okay,
and then it does add an extra burden. You're
okay.
absolutely correct that that additional burden, and for someone with HIV without a home,
Mm-hmm.
Mm-hmm.
obviously they're dependent on their medications.
Mm-hmm.
If you're unstably housed, the chances of you being faithful to medications, that's hard for all of us.
Mm-hmm.
But it's very difficult for someone who's homeless. So that is one of the reasons why there's so much effort around that. Usually there are programs that will allow people to get on the medications they need. So usually that's not the ultimate. It's usually an array of kind of other circumstances that probably even led to their HIV
Okay,
infection.
okay.
Okay.
Well, in my work, I see a
Mhm.
lot of issues with supply and demand. There's
Okay.
just so many people needing
Mhm,
housing, and
correct.
there's not a lot out there, unfortunately.
Yeah.
So sorry to kind of go off track a little bit.
Yeah. No, that's okay. I mean, it's
No,
a very
it's very
complex. It's a
important.
very
Yes.
complex problem. There's many different facets to this, obviously. Michael, how many
Yes.
people approximately receive assistance from Chicago House?
So with the variety of programs that we offer, we do serve about 2,000 people a year. Not all of them are receiving housing from us. Um, in terms of housing, we probably provide housing for about 400 to 450 individuals and families in our housing programs. We also provide a number of individuals. Hundreds of individuals come to us for employment services, but the vast majority of that 2,000 number is going to be what we call our HOPE program. And that's a program that really does testing in communities that are at risk. It does a lot of linkage to care services. The number one um, issue, really, for people living with HIV is not being linked to care and not being faithful to their
Right.
medication regimen. If they do those two things,
Mm-hmm.
we have a whole different world. So our HOPE program goes out in the community. We have a mobile testing van that is out in areas at community events. And so a lot of our people come in through our services, through our HOPE program and our testing and linkage to care work services. So uh, annually about 2,000 people, but we'd love to be able to have more availability to housing and keep increasing that housing number as well.
Sure.
Right.
Okay.
Right. So, in your opinion, Michael, what do you think is the biggest misconception that people in general have about HIV and AIDS?
I would simply say that it's over. People think somehow the AIDS crisis is over.
Wow.
Like, oh, this is still an issue. I'll have people say that to me.
Wow.
Like HIV and AIDS is still an issue. And part of that is because it's become, for many, a chronic condition. I'm myself a type 1 diabetic. I've had this chronic condition for 30 plus years. I don't really think anything of it. I take my medications. I do everything I need to do. But for people with HIV and AIDS, the same can be true. What people don't realize is the demographics of HIV. There are still individuals who are very much impacted, particularly Black and Brown communities and kind of metropolitan areas like Chicago, and clearly among men who have sex with men. So these are places where, even though the number of infection rates have gone down, all of the new infections are predominantly taking place in these very specific communities. And that is really why it's not over. It's fallen out of the consciousness. We don't see the red ribbons at the Oscars and all of these places. You know, there was such great outcry and support for really the AIDS and HIV causes. And that's kind of faded away. And yet there are still communities who are heavily impacted by this. And the stigma has not gone away. Maybe in some communities it has diminished, but unfortunately, unlike many other diseases, diabetes, cancer, all of those things, there still remains a huge stigma around HIV, which comes with a judgment and, you know, what did you do to get it? All of those things that you would never ask someone typically who's contracting cancer or comes down with diabetes. And so those are some of the things that are still existing.
Right.
And you know, it's people think that's gone away. It really hasn't totally gone away.
Do you think that possibly because the
Well,
there was such a large
death rate.
no, there was a large percentage. No, I was going a different
A
direction.
wholly different way.
There was a large percentage of people in Hollywood
Well,
that were actually supportive
right in
in the very beginning, but now that, like you say, has faded away. Do you think that fading has removed the impact that it's got to individuals, so that they don't even not people that aren't affected, but people that are affected, maybe they don't even have what am I trying to say?
I don't know. I was going to say, I don't think you don't hear about HIV or AIDS in the news as often as you used to.
Right.
And I kind of think that perhaps it's because individuals in the Black and Brown community are highly underserved in the public media.
Right. And maybe they're not that's where I was going. They're not getting even the education about it.
Right.
Yeah.
Well,
and you're not hearing about it.
And also, too, I think it's not a death sentence like it was when it first came out, with the medications and all that. I mean, people are still dying, but people are living longer and productive lives when...
And also, I think people become desensitized to something. Just like with COVID right now.
Oh, yeah.
After you've heard about it for an extended period of time, you just become desensitized. And which is sad as well.
It's also, I think what you're talking about is the notoriety that came with AIDS because of the arts community being so impacted. You had very, people out there that people listened to, that they saw, bringing attention to it. What COVID revealed for us in HIV is the same disparities that we experience in the HIV world existed in the COVID world.
Okay.
But COVID impacted everyone. So it revealed the disparities of healthcare in communities of color because everyone was now focused on it because it impacted them as well.
Right.
When HIV has fallen off the radar a bit and people don't think it's really happening much anymore, that disparity in Black and Brown communities is not even paid attention to. It doesn't even enter people's consciousness that we are still combating HIV in communities in a city like Chicago.
Okay. It's a shame. I mean, yeah.
Well, I think, it absolutely is. And I guess you only hear about it now in the news when it affects, like a different population has a spike in cases of HIV, such as the elderly community, and when there was a spike in elderly individuals being recently diagnosed, and that became in the zeitgeist all of a sudden. But Michael, how common is HIV today? You said that the goal is obviously to get to 0 cases, but where are we standing now?
So the number of infections have gone down. So in the city of Chicago, they just reached their census data. And last year, there were approximately 675 new HIV infections in the whole city of Chicago. So not a huge number. But the thing to remember is people have become longtime survivors of HIV. Still in the nation, there's about 1.2 million people living with HIV. And we still deal with the issue that probably they're estimating about 13% of those individuals don't even know they have HIV. So they are not getting the proper treatment and the proper care. Okay. And those are the individuals who are most at risk at passing on HIV to others. So sure. Still a large number. The other thing for us as we look at this, as we continue to drive those new infection rates down, mm-hmm. There is a new issue that's arising, which is the aging population. So because people are surviving much longer with HIV, it's anticipated that in the nation in the next 5 to 10 years, over 70% of those living with HIV will be 50 plus. And they've been on meds for a very long time. So we anticipate a lot of comorbidities, it's impacting their systems, and some of the aging process kind of being accelerated for those living with HIV. So those are some of the new things that are kind of on the horizon and things that we continue to deal with. The one other thing I'll throw out here is because so much attention, some of it's related to stigma, but resources and community effort in more metropolitan areas have really helped to stop the spread of HIV and to help those living with HIV. The highest rates of HIV infection are in the south of the US. And we could speculate why that is, but mm-hmm. some of that probably has to do with stigma. It has to do with people not necessarily being out about their sexuality and all of those other items that could come into play. But we continue to have higher rates of HIV new infections in southern states in the US.
Well, that leads me to my question. If someone is infected with HIV, how can they avoid spreading it to others?
Well, this is the miracle of medicine and the miracle of science. If someone contracts HIV and is on their medications and is able to be virally suppressed, which is pretty easy to accomplish as long as they take regular medication, if they're virally suppressed, they cannot pass on HIV. So a positive person who is faithful to their medication regime, who is virally suppressed, cannot pass on HIV. The virus does not appear in their system. Okay. And so that is really the number one goal. Sometimes people are afraid, I might have contracted HIV. Really, if there's any chance that someone may have contracted HIV, they should see their doctor immediately, because mm-hmm. the sooner they go on meds, the sooner they'll be virally suppressed, the sooner there'll be no impact on their system, and it will totally eliminate the possibility of them spreading HIV. Secondly, I want to make sure people here, not everyone knows, we have what we call as PrEP. And I don't know if you guys are all familiar with PrEP, but it's really pre-exposure prophylaxis. PrEP is used with people who are at risk of HIV, men who have sex with men, anyone who is in what we would call a high-risk population. And PrEP is the most effective tool for eliminating HIV. It is about 98% effective. It is tremendous at its outcome. And so we have all of the tools in the toolbox mm-hmm. to eliminate HIV. We have the medications for people living with HIV to achieve viral suppression. and we have PrEP for anyone who's vulnerable to HIV. Those two together is really why you hear people talking about getting to zero, because of the tools that we have at our disposal. We just need to make sure people know how to use them and that they actually use them. But it's a really kind of amazing place for us to be.
That is wonderful.
Are the medications covered by insurance?
The majority of medications would be covered by insurance, and then there are through public sources and even through pharmaceutical companies who provide HIV meds. There are all kinds of programs. So we would never, someone in our care, we would never have a situation where they could not be on their medications. Really quite important that that's possible.
Good.
And Michael, what is the difference between HIV and AIDS?
So really, HIV is a virus. So that's what people contract. They contract HIV. AIDS is really, the letters stand for the acquired immune deficiency syndrome. And it just means that HIV has reduced your immune system to such an effect that your body's unable to fight off basic infections, basic things that anyone else, the flu, pneumonia, any other things that people typically would be able to combat through their immune system. HIV has so diminished that immune system that people get the diagnosis of AIDS. And so it's really kind of that level. And then AIDS, because it's shutting down, it's the level of the immune system being shut down. People don't, you might say they don't die from AIDS, but they will die from some type of infection that's getting in that the body can no longer fight.
Right.
So that's kind of it's a progression. HIV is the virus. Once someone gets HIV, they have HIV for all time. There are some stories out there, but currently there is no cure for HIV. So once someone gets HIV, they're always going to have HIV. Obviously, it could be controlled through medications, but AIDS is the number of cases of HIV that turn to AIDS. Again, I'll use COVID. With the vaccines and all of the things that have come on the market, the number of COVID cases that lead to hospitalization and death has been drastically reduced. The same is true of HIV. The cases of AIDS, they still exist, but not as they used to.
Okay. And I think we were fascinated to learn from another guest that, I mean, there are also cases of congenital immunodeficiency, and individuals can have a, an autoimmune type of response where they're immunodeficient as well, which is interesting.
Hard to work with.
Yeah, and challenging. Well, it's challenging to find out that you have it.
Right. Michael, does Chicago House offer alternative therapies such as massage therapy, acupuncture, heat, ice, yoga, meditation, anything like that for your clients?
That would be spectacular. That would be spectacular. We do have occasionally relationships and partnerships that will come and do that more on a short-term basis. We would certainly refer people out to those type of services.
Okay.
Currently, we just don't have funding sources to do that, but we would certainly encourage that type of treatment for clients, particularly those who would respond to it well.
Which of those alternative therapies would be the most helpful?
I think it pretty much depends. Obviously, we want people to kind of be healthy. A lot of it's going to be connected. A lot of the people we are working with at Chicago House would be dealing with some other behavioral health issues and mental health issues themselves. And so these are the type of things that would be extremely important to relieve stress, to really help them with some of those kind of mental health issues that they're dealing with. So some
yoga,
of that would happen through some of the counseling.
Right.
Yes, exactly. They would be extremely helpful to those we serve.
Great. Okay.
Michael, what are the stages of HIV?
Actually, it's HIV as a virus. There are really no stages. We think of cancer oftentimes, the different stages. And HIV is, you get the virus, you have the virus, you're never going to get rid of the virus at this point. what you are trying to keep is letting that virus deplete your immune system. And early on, when people got HIV, we know the life expectancy was very short because that HIV virus was destroying their immune systems very quickly. Nothing was stopping it. And it led to AIDS, and we lost many of those people. There were people at the same time who caught HIV who, for just whatever reason, their immune systems were stronger and they were able to fight HIV. And even though everyone around them died, they survived. And as the medications came, they had assistance to fighting off that kind of attack on their immune system. So it's more about that. And so today, someone gets HIV and they go on their meds, there is no progression. There should be no stages. There should be no progression. It is just long-term care. I always use my own chronic illness, diabetes. Some people die of diabetes in 5 years, and others, I'm now going on 35 years living with diabetes because I pay a lot of attention and care for it. Will it still have an impact on my system versus someone who doesn't have that type of chronic illness? Yes. But the prognosis is so much better with the care. And we would say the same here. You are only going to see a progression of HIV if there's no meds being taken or they're irregular or something else is going on. Now I brought up the concept of the aging population. That's new ground. You know, HIV's only been around for 40 some years. We lost a lot of people in the beginning, but we're starting to see some of the impacts on the long-time survivors, and that is an area of much study going on right now.
Okay. So any medical students out there listening, if you're interested in a burgeoning new direction, this could be something you want to look into.
Okay. Michael, what role do the volunteers play at Chicago House?
Well, really, from kind of the very structure as a nonprofit, obviously we are run by a board of directors who are really heavily involved in not only the governance of the organization, but the fundraising for the organization. So we depend a lot on public dollars, especially as a housing provider. Ron, it's hard to provide housing on private dollars. Public dollars are essentially important. But we have a lot of other things we need to do for clients. And so raising private dollars through our board is very important. We also have a younger associate board who gets out in the community, does a lot of awareness, as well as some fundraising for us. Things like the AIDS Run and Walk, which just happened last Sunday here in Chicago down around Soldier Field. We had hundreds of people turning out to support all of the HIV organizations. It really was a tremendous day. Really one of my favorites of the year. And then also, I think there's a lot of work for us, particularly at Chicago House. We do run a families program in the Uptown community, and we're under construction on a new families program that's going into West Englewood. And that program often depends on the volunteers for tutors and support, all of those kind of services that we provide to our children in our after-school program. So a variety of different ways to be involved and getting connected with the organization. But obviously, we're super dependent on those people who give of their time and talents, and also treasure to support our work.
Okay, all right, thank you. What advice do you have for someone who was recently diagnosed with HIV?
Yeah, really, if someone's recently diagnosed, which is treatment. Really, there is absolutely no reason why someone should hesitate to go on treatment. I think, years ago, there were what we call the cocktail. People had to be on tons of different pills. That is very simplified. And actually, the long-term impact of going on treatment right away just can eliminate the attacks on the immune system, which just keeps people healthier. And if they go on treatment immediately, the chance of them spreading HIV to others is minimal, almost non-existent. And so those are super important, not to let the emotional impact of a diagnosis stop them from treating the physical side. Work through the emotional, work through all of that, but be on meds. do not delay. There is no benefit for delaying treatment. Okay. People just need to do that immediately.
You know, we never asked the question, what is the first symptom that someone may know that they may have been infected with HIV? Is there a symptom that they may recognize and say,
or is it just vital that people
know who their partners are
also,
with?
I think everyone should, I mean, and I know this is someone as a, I'm in a situation where I can do this and it's not problematic for me because I have the financial ability to do so, but getting regular health checks on a routine basis and having, you know, your typical tests and everything. And also where Lita and I are coming from, where we were both in the military, it was part of our routine where you went and you had your HIV test, and that was a requirement. And to us, it wasn't a big deal. There was no stigma. And then I just recall one time my mom going to her civilian provider and saying, "Oh, and I need to get my HIV test." And everyone in the waiting room kind of stopped and looked at her. And it was just like, what? We have to do this all the time. Like, is this not something everyone else does?
Right.
So just
But is that the only, I mean, is there a symptom that could pop up that would let somebody know that they have HIV?
And that's where it is regular testing is so important, because any type of symptoms that I could describe are going to sound like any other type of infection.
Got it.
And can be very much delayed. When someone gets HIV, it may have no impact on their system for a significant period of time. And because of that, the need for people to be, vigilant about testing. They know if they're being exposed or not. There's not a million ways to catch HIV. People know if they've been exposed, they should just test. There's absolutely, Chicago House offers anonymous testing, all kinds of ways to come in and get tested. So and any doctor should be able to do it today. I mean, it's just ridiculous that people would hesitate to test, but it really is difficult. They cannot depend on symptoms. They should not wait till they're sick, hoping that they won't get it if I don't go get tested. That just makes no sense. They really need to do regular testing. And again, I'm going to promote PrEP. Anyone who is sexually active, who is in a high-risk population, being on PrEP is just going to eliminate the chance of them catching HIV.
Okay.
Yeah,
Thank
great
you.
advice. Michael, thank you ever so much for joining our show today. How can our listeners learn more about Chicago House, and how can we all make our donation today?
Yeah, I would love people to go to our website at www.chicagohouse.org. We have a lot of information about our particular programs. There'd be opportunities to donate as well on that, and to learn more about how people could get involved. And do not hesitate to reach out through the website to our organization. People are interested in getting involved or finding out more or in need of services. All of those we'd be able to do kind of through connecting on our website and reaching out to us. Great. So we'd love to hear from people.
Well, then we will make sure that we include a link for your website on our website.
Yes.
Yeah, thank you so much for your time this morning.
It's great to be here. I love talking about Chicago House, and I love talking about the fact that we're going to get to zero. We have the tools, we can make it happen, and the awareness that you're spreading to others is vitally important to that cause.
Great. Thank you. If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com. We're also on Facebook, Twitter, Pinterest, Instagram, and TikTok.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or the qualified healthcare provider with any questions you may have regarding a medical condition or a treatment, and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.